The first criterion that we'll apply for defining abnormality is deviance. We illustrated this approach with the case study of Trevor. If you classified Trevor's behavior as abnormal, you might have noticed some of the characteristics, like the fact that he is drinking more regularly and the frequency of his drinking, so he's drinking 3 nights each week. You might have commented on the amount that he is drinking, so 6 to 12 beers over the course of a night would meet CDC criteria for an episode of binge drinking. You might have noticed that his ability to consume an amount of alcohol has changed over time. He now has a reputation for being able to hold his alcohol, which you could see as evidence that he is developing greater physiological tolerance for the alcohol. We also see some evidence that he's experiencing negative consequences from his drinking behavior. So he has blacked out from drinking, he's had legal consequences with a DUI, and he's having some academic consequences. So he's missing classes and his grades have lowered. And we also know that there are some people who are concerned about his drinking. So Trevor's mom has expressed concern. If you did not characterize Trevor's behavior as abnormal, you might have been picking up on characteristics such as the fact that he is a college student, and this kind of drinking behavior is commonly associated with college students. Particularly, Trevor has joined a fraternity and primarily drinks at fraternity events, where it's likely that the frequency and amount of his consumption is fairly consistent with his fraternity peers. We can get a sense of the norms and expectations within Trevor's fraternity because we know that he's been made fun of for being a lightweight earlier in the year. And we also hear from his dad, who is a Duke alum and maybe has some similar experiences to what Trevor is experiencing now, who's saying that Trevor's mom just doesn't understand college, so suggesting that he thinks that this is pretty normative behavior. So deciding whether or not we're going to characterize Trevor's behavior as abnormal illustrates some of the limitations of the deviance approach to defining abnormality. And if we are applying this criterion to distinguish normal behavior from abnormal behavior, we're defining abnormality as deviance from statistical or cultural norms. So how far an individual's behavior is either from the norm statistically or from what is considered culturally normative. When we're thinking about statistical normality, you can think back to Psych 101 and the normal curve. So we know that many human traits can be described as falling on a similar curve to this, where most people's scores are clustered close to the mean or the average. And about 68% of individuals will have scores that fall within 1 standard deviation above or below the mean. 95% of people will have a score that falls within 2 standard deviations, and 99% of individuals will have a score that falls within 3 standard deviations of the mean. So if we're defining something as statistically abnormal, we might be deciding a degree to which they differ from that mean. Maybe it's 2 standard deviations, maybe it's 2.5, maybe it's 3 standard deviations. There are lots of thresholds that we could pick, but we would characterize behavior as abnormal if it exceeds that statistical threshold. We can also think about cultural norms, and we can define behavior as abnormal when it's significantly different from the norms or expectations of a person's cultural context. So as we saw with Trevor, there are some limitations of this approach. One of the limitations is that just like we have difficulty defining what abnormality means, we're also going to experience some similar challenges defining deviant. So some challenging questions might be, how far from average are we going to consider abnormal? What is our threshold? Is it 1 standard deviation? Is it 2? Is it 3? And what are the criteria that we use to define our threshold? Another challenge we have to think about is whether we are going to consider potentially positive differences from average to be abnormal. So in the case of Trevor, We might use statistical norms to determine whether an excess amount of drinking is abnormal. But what about college students who don't drink at all? If they are drinking statistically significantly less than the majority of their classmates, is that behavior that we would want to characterize as abnormal? So defining our definition of deviant can be a major challenge when we're applying this approach. Another challenge is cultural relativism, particularly when we are thinking about deviance from cultural norms. So it's important to keep in mind that behaviors that violate social norms in one culture may be common in other cultures. One example of this is how people respond after the death of a loved one. In the United States and in many Western cultures, it is fairly unusual for people to report that they have seen a deceased relative or spoken or heard from a deceased relative. But there are other cultures in which this kind of experience, particularly following the death of a close loved one, is normative and often a culturally expected and culturally sanctioned part of the grieving process. So we want to keep in mind that many of our disorders have been defined in a primarily Western context. This semester, we are going to be relying on the Diagnostic and Statistical Manual of Mental Disorders, which is published by the American Psychiatric Association. And we need to be mindful that behaviors and experiences that are considered culturally normative within an American or a Western context might not be culturally normative or usual in other cultures. And similarly, there might be behaviors or experiences that violate social norms and expectations in the dominant culture, but that are expected and normal within the context of a given culture or even within a subculture. So we need to be mindful of cultural relativism if we are characterizing behavior as culturally deviant. Another limitation is that unusual behaviors may not cause problems. So there are plenty of behaviors that might be either statistically deviant or culturally deviant that may not cause problems, may not lead people to experience difficulty in their day-to-day lives, may not bother those people, may not bother other people. So we want to be careful about assuming that that deviance indicates that those behaviors are abnormal. There's also a concern that common behaviors may be problematic. So even if a behavior is statistically very common, even if a behavior is culturally sanctioned, there may be behaviors that are concerning because of the degree to which they affect an individual's functioning, or they may have other important implications. So we may not want to characterize behavior as normal just because it is statistically or culturally common. To give another example that illustrates some of the challenges of the deviance approach to defining abnormality, I want to talk briefly about the history of pathologizing sexual orientation. So if we start by thinking about its potential statistical deviance, here is some data from 2013 in the United States based on self-reported sexual orientation of adults. You'll see changes in this data depending on how you ask about it, depending on what year you're asking this question and who your population is. But you can see in this sample that the vast majority of both men and women in the United States identify as straight or heterosexual. So over 95% of adult men and women in the United States in 2013 identified as straight or heterosexual, and less than 5% identified as bisexual or gay or lesbian. So from a statistic deviance perspective, we could characterize bisexuality or gay or lesbian sexuality as statistically deviant or uncommon. When we think about cultural deviance, we see some changes in these cultural norms and expectations over time. So this is data from Gallup polls that were conducted between 1977 and 2020. Over time, the wording of the polls has changed, but all of these questions are broadly investigating whether adults in the United States favor rights for adults in consensual gay and lesbian relationships, do not favor those legal rights, or have no opinion. You can see in 1977, adults in the United States were about evenly split, and less than half of adults favored these rights. You actually see an increase in the proportion of adults who do not favor rights for gay and lesbian adults. But starting in 2001 and increasing over time, we see an increase in favorable attitudes towards legal rights for gays and lesbians over time. 2001, we see over half of adults in the United States in favor of this, and that's increasing and approaching 3/4 of adults in 2020. So if we were using a cultural deviance perspective, we would be seeing shifts in whether or not these relationships have been seen as culturally deviant over time. And we can see this reflected in the way that the DSM has addressed sexual orientation. So in the first edition of the Diagnostic and Statistical Manual that was published in 1952, homosexuality was included in the DSM and it was classified as a sociopathic personality disturbance, so characterized along with other kinds of behaviors that were considered to be indicative of a problematic and pathological personality. In the DSM-2 that was published in 1968, homosexuality was moved and it was classified as a sexual deviation. So homosexuality in and of itself was still considered disordered. It was no longer considered sociopathic, but homosexuality was still considered to be a mental illness in the DSM. The first time that changes is in 1973. So in 1973, homosexuality was removed from the DSM, but they added a new disorder called ego-dystonic homosexuality. So ego-dystonic homosexuality was a diagnosis that could be applied when an individual identified as homosexual and their sexual orientation caused them distress or they wanted to change their sexual orientation. So there was still the assumption that the experience of a non-heterosexual sexual orientation could be indicative of a mental illness if that experience was distressing to the individual. In 1994, when the DSM-4 was published, ego-dystonic homosexuality was removed from the DSM. And then in 1998, the American Psychological Association released a position statement in which they explicitly opposed psychiatric treatment that is based on the assumption that homosexuality is a disorder. So they are taking the stance that it is not ethical to attempt to treat someone's sexual orientation with the goal of helping an individual develop a heterosexual sexual orientation. And you can see in this position statement, this is reflecting an explicit stance that a non-heterosexual sexual orientation is not indicative of mental illness and is not inherently pathological and not something that should be changed. So we can see in the evolution of these DSM criteria over time that we are seeing the influence of these changing cultural norms and how these cultural norms and expectations have shifted is being reflected in how the psychological community is drawing the line between normal and abnormal behavior. If you're interested in seeing another example of scenarios that challenge this definition of defining abnormality, I encourage you to check out this 2018 article that asks the question, are we overdiagnosed and over-medicated?